My name is Nancy Turek. I'm a vascular access specialist, and I now reside in Springfield, Missouri. Over the last 30 years in vascular access specialty practice, I've seen a lot of evolution of technology in applied practice. And as a clinician, being able to discuss that with other clinicians and understand their needs, their problems, and what causes them the most pain when they're working at the bedside, I really like to listen to that and uncover problems and then empower them to look beyond the status quo at the future and how they can take their clinical experience and maybe expand on that. So I am an encourager, I am a challenger, and I feel very accountable for supporting those who are growing up in vascular access. I think that securement is a huge issue. And the presentation this morning on movement of catheters and vessels, I thought it was excellent. It's a good segue into what occurs on the interluminal surface of a vessel with the movement of the device. I would like to see that expanded, not only related to the device, but to other clinical complications that we underappreciate and undervalue and just let it slide under the rug. So I'm trying to learn more about, in addition to movement, what other factors in infusion affects the intimal surface, setting that patient up for a complication. And so I'm very directly involved in that now and doing some consulting and learning a lot about the topic. Not only in the United States, but around the world, fragmented processes really drag down productivity that impacts patient outcomes, whether it's logistics, whether it is a treatment plan that's not communicated between one shift to the next, and that stalls the process for caring for patients and discharging them. And so my perception is that the system for communicating between people in healthcare, patients in the home, and how to prepare the consumer to become a vascular access patient. We need to empower our patients and families to be comfortable with asking questions. And so doing so requires advocacy outside of the hospital, more aligned to perhaps safety issues with the government. And I think it's multifactorial. But I do believe that there's a lot of improvement we could make through educating patients and their families on what to ask, what to expect, and what not to accept in their care.